Remember that the number one way to support our program is very simple. Grab a membership at joinpakman.com up through Election Day. You can take advantage of the coupon code 2020NOW, 2020 NOW, no space, all lowercase. Well, numbers can't be lowercase, but you understand. Grab a membership and you will also get access to the daily members only bonus show at joinpakman.com. So Donald Trump left Walter Reed Medical Center yesterday. There's a real question about the disease progression. We don't really know exactly what his health status is, but we didn't need to wonder too much when Donald Trump arrived back at the White House in a complete propaganda moment. Donald Trump defiantly stood saluting and watching Marine One, the helicopter, leave after depositing him back at the White House. Donald Trump removed his mask in what I guess was supposed to be framed as some kind of act of courage, despite it being very, very risky, given that Donald Trump, by all accounts, is still very contagious. And what was interesting about that moment is that as Donald Trump stood and watched Marine One leave, you can tell that he is struggling to breathe. Trump is gasping for air and using his neck and upper chest muscles to actually breathe. Medical experts who watch this video agree that that is indeed what we are seeing here. Donald Trump at another moment, again, after removing his mask, of course, wincing in pain as he tries to breathe. This is a sign of serious coronavirus still affecting Donald Trump. And bear in mind that this is Trump struggling to breathe while on corticosteroids like dexamethasone, typically reserved for patients in an ICU with coronavirus, on a ventilator with coronavirus, or having such breathing issues that they are expected or projected to need that level of care soon. That's who typically gets dexamethasone. Donald Trump getting it, we've gotten no clear explanation from his doctor as to whether this was indeed because Donald Trump is that sick or because he's merely the president and they're throwing everything at him. But Donald Trump there, wincing in pain, struggling to breathe. Author Mike Jollett on Twitter posted some text messages he exchanged with a cardiologist friend of his from a major hospital. And what we are seeing is the same thing that doctors are seeing. Trump visibly struggling to breathe. The doctor actually says, saw a brief clip of his breathing and it looks pretty bad. Watching a longer stretch now, not good breathing. The same doctor later adding that if he does go back to Walter Reed, his chance of survival becomes quite low. He will not go unless he is in dire straits. He is basically getting hospital level care in the White House. Now, the doctor also says Trump can't get ICU care at the White House. There is speculation that something close to an ICU has been set up at the White House medical unit in the event that it becomes necessary for Donald Trump. We just don't know because they lie all the time, constantly about everything. What we can surmise is Trump probably is partially feeling okay enough to start demanding a ride around the block and to start manic tweeting and to demand to go back to the White House. Partially, he's feeling like he can do that because he is on steroids that can cause euphoria, mania, and delusions of grandeur. That's one piece of it. The other side is that the disease can have a progression where once you are 7 to 10 days in, there is a sort of second wave. Donald Trump reportedly plans to be at the debate next Thursday. Is that possible? Well, we just won't know until we get at least to this weekend, at which point many people get much worse and deteriorate. We really don't know. Trump's doctors are not being forthcoming. And we are going to have to wait and see. What we need to get on the table now is Joe Biden must be protected at all costs. Joe Biden had 3 negative coronavirus tests since being presumably exposed at the first debate last Tuesday. And if indeed Donald Trump plans to be at next Thursday's debate, Joe Biden has already said he will consult with his doctors and figure out what it is that they advise him to do. I would not find it overboard to request that Biden be 20, 30 feet away from Donald Trump. Bring plexiglass, do whatever he has to do. Biden must be kept safe from Donald Trump, who has effectively become a super spreader. If you are anything like me, You probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1 hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.